The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. You are listening to Itchy and Bitchy, a podcast that provides answers to your many health questions. I'm Karen Nickel, family nurse practitioner, and in the last episode of Itchy and Bitchy, I talked to you about catabolism and anabolism and the advantage of conversion from a catabolic state to an anabolic state. And if you're scratching your head, it's because you didn't listen to the last episode. So I also let you know in that episode that I would talk to you this episode about supplements that can help make that conversion happen. So if you did not listen to the last episode called Is Your Metabolism Creeping and Crawling?, I encourage you to listen to that episode before listening to this one, because otherwise a lot of this won't make a ton of sense. So learn about catabolism and anabolism in the last episode called Is Your Metabolism Creeping and Crawling? And then you'll be up to speed on what we're talking about today. Peptides are composed of amino acids and created when two or more amino acids are joined together. And peptides are present in every living cells. Different types of peptides influence different types of cells. And the peptide therapies discussed today are those that improve the levels of growth hormone, which we often abbreviate as GH, but that is growth hormone, to provide a number of benefits. Peptide therapies can be used in an effort to help the body convert from a catabolic state to an anabolic state. When we remain in a catabolic state long term, it can cause fat gain, muscle and bone loss, adrenal fatigue, energy swings, poor energy, hunger, increased blood pressure, and the downregulation or slowing of metabolism. The mechanism of how growth hormone releasing peptides work is not completely clear. At present, the data favors the hypothesis that GHRPs, which are growth hormone releasing peptides, GHRPs, act by increasing activity both at the pituitary and the hypothalamic level to increase secretion of growth hormone or growth hormone releasing hormone. And that's the hormone that tells the pituitary gland to make more growth hormone. There aren't studies on use of peptides for weight loss in particular, but there are human studies that show that the use of peptides can reverse the catabolic state. Again, if you haven't listened to the previous episode titled, Is Your Metabolism Creeping and Crawling?, I strongly recommend that you listen to that first so you have a better understanding of catabolism and anabolism. The use of peptide therapy specifically for weight loss is usually only provided by anti-aging or functional medicine practices. These peptide medications have to be prescribed and managed by a licensed medical provider. Those providers who practice in anti-aging or functional medicine clinics may recommend treatment with peptides in an effort to achieve some or all of the following benefits: weight loss, muscle building, improved immune function, faster wound healing, better cognitive function and memory, a healthier gut, enhanced sexual performance and libido, skin rejuvenation, hair growth, bone and joint health, and longevity. So it's a long list of benefits. I am going to talk specifically about the peptides typically used for weight loss. The first one is ibutamorin, which is often referred to as M as in Mary, K, MK677. And it is an oral growth hormone peptide that can help increase growth hormone levels, resulting in increased energy, increased metabolism, and lean muscle mass and decreased body fat. MK677 is a growth hormone secretagogue, which means it stimulates the pituitary gland to release stored growth hormone to the body for use. By using growth hormone secretors, the body increases production of its own growth hormone. Increasing growth hormone levels can help the body repair and rejuvenate itself over time. When this happens, the aging process slows down. Other peptides used are injectable, but MK677 is a desirable option because it is orally administered in a tablet form and remains active in the body for a longer period of time. Ibutamoren requires only a once daily dose at bedtime and remains active for roughly 24 hours in the body. By stimulating the production and secretion of growth hormone, ibutamoren MK677 can help increase lean muscle mass, build strength, and decrease body fat. Ibutamoren has been shown to increase the amount of time spent in stage 4 deep sleep by 50%, as well as REM sleep by 20%. And the more time spent in the deep sleep, the better your body can recover and repair itself. MK677 stimulates the production of IGF-1, which is insulin-like growth factor hormone 1, which can help decrease body fat, increase muscular development, and increase natural strength. Ibutamoren can be used in conjunction with injectable peptides such as Sermorelin for a greater effect. And I'm going to talk to you about Sermorelin in a few minutes. So after this break, I will review the 2 growth hormone releasing peptides, GHRPs, that can be used in conjunction with ibutamoren. We'll be right back. Many of us do not eat a balanced diet. How many times have I said that on this podcast? For instance, over 97% of women aged 19 to 50 are not getting enough vitamin D from their diet, and 95% are not getting their recommended daily intake of key omega-3s. Ritual's Essential for Women 18 Plus multivitamin helps fill those nutrient gaps and is formulated with nutrients to help support brain health, bone health, blood health, and provide antioxidant support. Ritual invested in a gold standard university-led clinical trial to prove the impact of Essential for Women 18 Plus multivitamin, and the trial showed that vitamin D levels increased by 43% and omega-3 DHA levels by 41% in just 12 weeks. Ritual is committed to third-party testing from USP and the Non-GMO Project, traceable and vegan-friendly ingredients, and always clear communication. I have started taking Ritual's Essential for Women 18 Plus multivitamin. I haven't had an upset stomach. They're very easy to take, and frankly, I love the way the vitamins look. Right now, Ritual is offering my listeners 10% off your first 3 months. Visit ritual.com/itchy and turn healthy habits into a ritual. That's 10% off at ritual.com/itchy. Two injectable peptides that can be used to aid weight loss are Sermorelin and Ipamorelin. Sermorelin and Ipamorelin peptides are very similar in many ways. Despite their similarities, however, these two peptides are different enough that their applications can be tailored for specific needs. Both peptides stimulate the natural secretion of growth hormone, but they do so via different receptors. Because of the way they affect secretion of growth hormone levels, ipamorelin and sermorelin both cause increased fat burning and muscle building, enhanced long bone growth, decreased inflammation, and improved wound healing. However, because they impact different receptors, these two peptides have slightly different additional effects. Sermorelin promotes lean body mass gains, boosts fat burning, and fights the effects of aging. It also maintains the natural pulsatile release of growth hormone, and as a result, helps the body to maintain youth-like patterns of growth hormone secretion. Ipamorelin is the more potent of the two peptides. It raises the growth hormone levels more than sermorelin. Those levels fall more quickly, however. Ipamorelin builds lean body mass, but also builds overall body mass. It is also a potent stimulator of bone growth and has some pain-fighting properties as well. At baseline, sermorelin potentiates growth hormone release and helps to extend growth hormone highs. It is best thought of as extending growth hormone peaks and prolonging the amount of time that growth hormone levels are elevated while preserving the normal ebb and flow, that pulsatile secretion of growth hormone throughout the day. Ipamorelin, on the other hand, is better thought of as dramatically raising growth hormone levels, sometimes by as much as 13 times above baseline levels. Ipamorelin has dramatic but short-lived effects on growth hormone levels. There are slight differences between the two in terms of producing lean body mass. Both sermorelin and ipamorelin favor the development of lean body mass over fat mass, but sermorelin is the more potent of the two. This is due to the fact that sermorelin is both a growth stimulator and a fat burner, while ipamorelin is a more general growth stimulator. That is not to say that ipamorelin isn't effective. It is, but ipamorelin isn't as strictly favorable of lean body mass deposition as sermorelin. Both peptides stimulate the development of bone and other connective tissue, but ipamorelin appears to have the advantage in this realm. In fact, ipamorelin is so effective in boosting bone density and mineralization that it has been investigated as a potential treatment for corticosteroid-induced bone loss as well as osteoporosis. So if you have bone loss from long-term steroid use, corticosteroid use, they're investigating the use of ipamorelin to offset that problem. When it comes to muscle growth, sermorelin is probably the big winner, though this can be debated endlessly. Sermorelin not only boosts muscle hypertrophy and hyperplasia, that means increased stimulation, it reduces fat mass and thus causes a shift in body chemistry toward lean body weight. In other words, sermorelin will always favor the production of lean body mass, even if diet is not perfectly geared toward muscle development, whereas ipamorelin is more of a mixed bag. It will always cause muscle growth, but ipamorelin may channel some of those calories into fat deposition as well. Both ipamorelin and sermorelin, via their growth hormone releasing potential, have potent anti-aging properties. Sermorelin, however, is the clear frontrunner in this particular face-off. Sermorelin has been shown to improve joint function, skin thickness, skin collagen structure, wound healing, cardiac fibrosis, strength, and metabolism. It has been found that over an individual's lifetime, you would find that sermorelin tends to be the peptide that provides youthfulness. One of the biggest differences between ipamorelin and sermorelin lies in the fact that ipamorelin triggers a peptide that is an important neurotransmitter in the control of appetite and food preference, but it also plays an important role in how we perceive pain. In fact, the connection between food and good feelings are likely due in part to the effects of this peptide called neuropeptide Y. Studies using rats indicates that ipamorelin may help to reduce pain perception by as much as twofold. This is especially true of a type of pain called visceral pain, which most people would call stomach pain. Visceral pain is difficult to treat, so ipamorelin offers a potential starting point for understanding how to better control pain associated with conditions like irritable bowel syndrome, Crohn's disease, ulcerative colitis, and more. There are also potential applications in neuropathic pain syndromes like diabetic neuropathy and degenerative disc disease. Studies in rats also show that sermorelin is an effective regulator of the sleep cycle. Poor sleep and aging are strongly associated. Older people often have less restful sleep. They just don't sleep as well. Sermorelin appears to achieve its sleep benefits by regulating the release of a neurotransmitter that is important in sleep regulation. Its sleep effects may be one of the reasons that sermorelin is a potent anti-aging peptide, why it provides that youthfulness. There is limited research on the effects of combining sermorelin and ipamorelin. You all may be asking, well, since they do different things, why don't you just combine them? Which would make total sense. Because these peptides affect two different receptors, their actions when combined tend to be synergistic. However, because of the lack of research, there is little data on how the combination of these two peptides can help to improve appetite, alter body composition, fight off cardiovascular disease, slow the progression of aging, and promote good general health. Individually, both ipamorelin and sermorelin have been studied extensively for their significant impacts on growth hormone. Both peptides are effective but have slightly different benefits, as I've reviewed with you. By now, you may be wondering if you can just purchase peptides from a store or the internet. You can, it is possible, but it's very important to remember that there can be some questionable manufacturers out there that make it nearly impossible to sort out which are good and which are not. The purity of products is a critical aspect to effective peptide therapy. You want to get the right thing so that it works. By buying it yourself without knowing for sure, you could run the risk of subpar or ineffective compounds. Quality control can be an issue for the everyday buyer. Therefore, you could potentially purchase contaminated or dangerous compounds manufacturers have created without regulation. In the United States, only a few compounding pharmacies actually create these peptide supplements due to state restrictions. And the FDA does not currently regulate supplements in the same way as traditional medicines, and peptides are currently approved only for research purposes. So it's important that you exercise caution and discuss it with your physician, nurse practitioner, or physician's assistants in advance of starting something like this. If your primary care provider isn't comfortable with managing these meds, you can consider med management through an experienced provider at an anti-aging or functional medicine clinic. In the last episode, I told you about my patient who I call Jane. To help with her symptoms of a chronic catabolic state, she is going to be starting sermorelin and MK677 in combination. She will continue a high protein, low carb, low animal fat diet. She will lower the intensity and duration of her exercise. She was none too happy about that last recommendation, but she is willing to give it a whirl. I will update you on her progress on a future episode. Please visit our Facebook page, I&B Podcast, where you can leave comments or questions. I love to hear from you. Our website is itchyandbitchy.com. Many thanks to Ritual for sponsoring today's episode. And as always, thanks to Forrest Winsel, our producer and composer of our theme music. Again, he has released an album called An Awful Lot. Make sure to go wherever you stream your favorite music and listen to it. It's fabulous. If you don't know where to stream music, you can find the album on Apple Music or Spotify. As always, remember that your health is in your hands.